Womb transplant surgery, also known as uterine transplantation, was a relatively new and experimental procedure. It involves the transplantation of a uterus womb from a donor into a recipient who either does not have a uterus or has a non-functional uterus due to a medical condition. The procedure can be complex and involves several stages. Donor selection. A healthy uterus is typically donated by a living donor, often a close relative or a friend. The donor undergoes thorough medical and psychological evaluations to ensure compatibility and to rule out any potential health risks. Recipient evaluation. The recipient also undergoes rigorous medical, psychological, and ethical evaluations to determine their eligibility for the procedure. The recipient must have a healthy immune system to prevent organ rejection and should be physically able to handle the procedure and potential pregnancy. Surgical procedure. A. Donor surgery. The donor undergoes surgery to remove the uterus, fallopian tubes, and blood vessels while preserving the blood supply. The procedure is similar to a hysterectomy. B. Recipient surgery. The recipient's surgery involves creating a connection between the transplanted uterus and the recipient's vagina, ensuring that the blood vessels and surrounding tissues are properly connected. This step is critical to ensure proper blood flow and reduce the risk of organ rejection. Postoperative care. Both the donor and the recipient require intensive postoperative care. The recipient will need to take immunosuppressive medications to prevent her body from rejecting the transplanted uterus. These medications suppress the immune response but also make the recipient more susceptible to infections. Monitoring and recovery. Regular monitoring and follow-up are essential to ensure the transplanted uterus is functioning well and that there are no complications. If everything goes well, the recipient may be considered for embryo transfer to attempt pregnancy after a certain period of recovery and stabilization. It's important to note that womb transplant surgery is still an emerging field, and not all medical centers are equipped to perform such procedures. The procedure carries significant risks, including organ rejection, complications from immunosuppressive medications, and potential surgical complications. Since medical advancements are constantly being made, I recommend checking with a medical professional or a reputable medical institution for the most up-to-date information on womb transplant surgery and its procedures.